I'm Norbert Gleicher, MD, and I'm the Medical Director and Chief Scientist here at the Center for Human Reproduction in New York City. Our topic today is what to do if you experience a chemical pregnancy. Now, what is a chemical pregnancy, first of all? A chemical pregnancy has its name from the fact that it is only diagnosed by chemical means, meaning a positive pregnancy test, usually a low titer positive pregnancy test, which very quickly turns negative. What does it mean? When you have a chemical pregnancy, it means that an embryo has implanted, because in order to have a positive pregnancy test, which means HCG hormone in your blood, the implanting embryo which produces that HCG hormone has to make contact with the mother's blood system. Otherwise, the HCG would not be detectable in her blood. And so, even if the HCG value, the pregnancy test value, is still very low, and you see HCG in the mother's blood, you know an implantation has occurred. And that is important, because studies many, many years ago in the early days of IVF very clearly demonstrated that if you take 100 women who have a chemical pregnancy in their first IVF cycle and compare them to 100 women who had nothing, who just had a failed cycle, the 100 women who had a chemical pregnancy in their first IVF cycle, in their second IVF cycle, had better pregnancy rates. This is important because that obviously means that there is a clinical meaning to having a chemical pregnancy. And the clinical meaning is that it shows that you as a patient can encounter an implanting embryo. In other words, your implantation processes seem to work, which obviously then raises the next question: why did I lose this pregnancy in these very early stages? And there are basically really only two answers for that. The first answer is that this was a bad pregnancy, meaning usually a chromosomal pregnancy. And nature, in her wisdom, simply terminates this pregnancy early because it recognizes that this is an abnormal pregnancy. In other words, it is a defense mechanism that nature has built in against us having more abnormal pregnancies. The second potential reason is that there is something wrong in the implantation process, or I should say, in how the maternal immune system accepts the implanting embryo. Remember, when an embryo is trying to implant in the uterus, it is like the mother gets a little mini organ transplant from her husband. Now, if she were really to get a kidney transplant, for example, from her husband, in 99.99%, the mother would violently reject, or her immune system would violently reject this transplant. Yet, an embryo which is in 50% foreign genetically to the mother, because it represents the father genetically, yet that embryo, that little sucker, is not being rejected. And the reason for that is that the maternal immune system reprograms itself to allow that embryo to implant and to grow. It makes the embryo invisible immunologically. And that process in some women doesn't function well. And that is the second major reason for chemical pregnancies. Chemical pregnancies are very frequent. Many chemical pregnancies are not even recognized because all that a woman will see is that she is 1 or 2 days late for her period. Indeed, studies have shown that as much as a third of all pregnancies may be chemical pregnancies. So It's important to know this when you have a chemical pregnancy. It is particularly important to know this when you have repeat chemical pregnancies. But in principle, if you have just one chemical pregnancy, there's not much to worry about. Once you experience repeated chemical pregnancies, then they count like miscarriages, like regular miscarriages. And once you have had 2 or 3, then obviously it's time to start looking for what is causing it. I hope that helped. It was nice talking to you today, and if there are any more questions, you always know where you can reach us. Thank you.